I'm ecstatic about the Cancer Center opening. From the radiation standpoint, we've been able to see patients here, talk to them about the types of radiation treatment that they'll be getting, but we haven't yet had the ability to be able to deliver that care here at Hancock Regional. But now knowing that the center is open, and you don't have to say to your patients, I'm going to have to ask you to get onto 465, or I'm going to have to ask you to drive an additional 30 minutes from home, when you know they're getting 5 to 6 weeks of treatment, for me is just absolutely wonderful, because I can deliver that care, and I can deliver it actually with a much better treatment system using the new TrueBeam technology. So one of the things I'm most excited about is we have invested in technology here at Hancock that is truly state-of-the-art. And what that translates to is being able to treat patients with greater safety, just as efficacious as we've done in the past, but we're able to deliver it in a much faster way. And so that matters. If you're a patient who's in pain and you're laying on a hard, flat table, you're literally counting the seconds that you're laying there. The ability of this machine to be able to deliver that treatment so much faster takes away the majority of the time that they're having to lay in that same position. One of the things that I think sets Hancock Regional apart from other hospitals is that they can offer incredible treatment just from a technology standpoint. But I think the most important piece is that from the patient experience, we know your name here, we know who you are, we know your families, and I think that's something that gets lost in big hospitals. We want you as the patient to know that you are our priority.
I was born here 43 years ago, so I've seen a lot of different changes. One of the things I think they've done in the last 5 years that I'm most impressed with is allowing the patient the opportunity to take care of their care online. I have so many options available to me. I also always feel like I get quality care when I come here. My questions are always answered. The previous center was very compact. There was no natural light. We felt like we were on top of each other. It's just very nice to be up here, to be able to spread out, to see the garden behind me, and to know that the sun is coming in while we're going through something that's not exactly fun. Anna, the RN that I work with most times when I get treatment, has been very responsive and helpful, and I feel like we've formed a bond. She talks about her family, I talk about my family. It just makes it easier when I'm in here. Being able to be here in Greenfield when I'm managing as much as I am with the treatment, it's just a godsend. Traveling to Indianapolis is 45 minutes each way. I have to have somebody drive me because I get Benadryl and other drugs that don't allow me to drive home. So it's a matter of scheduling somebody to be with you, not just 4 hours for a treatment now, but with the drive you'd be looking at 6 to 7. I also don't feel very confident that I would get the kind of care from a provider in Indianapolis that I do here. When you go through cancer, family suddenly does become everything, your priorities shift. And so just being able to manage my life here and not have to add anything additional has been real helpful.
Coming from Indianapolis, I am previously was not real keen on going to what I would term a rural hospital, but I was very glad to find out that Greenfield is the furthest thing from what my concept of a rural hospital was. Just the environment was so much more welcoming, and it felt a lot more healing with how they've done the design. I mean, there's more to treatment than just atmosphere, but atmosphere is so important. Psychologically, it's much more welcoming. Going through cancer treatment, it's okay to be afraid, it's okay to be scared. It's not okay to hold it inside and not reach out to your caregivers and your doctors and your nurses. A lot of people find it very uncomfortable to do that because it's a very scary time in your life. And Hancock, the staff is just amazing to make you feel very comfortable and to address the hard questions that most cancer patients and ultimately survivors have.
I love being an oncologist, and I love being a radiation oncologist because we have this distinct blessing that we get to be a very big part, intimate part of people's lives when they're going through some of the toughest situations. And everyone always says, oh my gosh, your job must be so hard. But what they don't know is we get to see these beautiful moments in people's lives. We get to see times when families come together, people find strength that they never knew they had. And so that journey with them is just an incredible experience. And each patient impacts you in a way that you would never be able to predict. And there are moments when you're, very excited for them, and there are moments when you're just heartbroken for them. But in the end, you come away with this sense of, I love what I do, and I love being part of people's lives.